Hi there, my name is Olivia Nomura and I am the Implementation Specialist here at Ocean. Today I will be presenting the shared care planning contract changes for this upcoming fiscal year of 2025. And before we start, we just want to show an introduction from our director, Ben Hoffman.
Hey, it's great to see you. Sorry we're not actually in person. As you know, we've collaborated partnering to support work on shared care planning since 2017. And in that work, we've celebrated a ton of success with you and have worked to innovate solutions to address challenges through collaborative problem solving. At our statewide meeting last fall, you gave us crucial feedback around some of the challenges you face to implementing shared care planning and gave us great ideas about how we can move forward. We learned especially about how you partner with other groups and organizations in your communities who convene care planning meetings, sharing successes you've had in helping to deliver family-centered care coordination through those partnerships in meetings like IEPs, wraparound, 504s, ISPs, and a bunch of others. We brought together a group of families of children with special health care needs to gain their insights around shared care planning, and their feedback reinforced our beliefs and corroborated your feedback on the value of family-centered shared care planning. In response to all of that information, we've been reimagining how we can do it and do it better to meet your needs and those of the families you serve. We're excited to share those plans, and we look forward to continued partnership with you and your communities. I want to specifically thank you for all you do to support the kids and families and communities of this great state, and we're really excited to continue the partnership and continue the growth.
Next, I'm going to describe our process for making changes and introduce some new requirements. You'll recall that last fall, we introduced our plan to make changes to shared care planning in a Zoom meeting. We took questions and followed up on that with a Q&A so that you'd be able to make decisions about whether to continue on with shared care planning or not. We then sent out a survey where you indicated whether you want to opt in or out of shared care planning. The results were 5 LPHAs opted to discontinue shared care planning altogether. 4 LPHAs opted to increase the number of shared care plans, and everyone else opted to continue the same amount of shared care plans. And again, as Ben mentioned earlier, we sought input from a Cocoon work group and a group of parents of SHIN to decide our decision making. With all that information in hand, we then went into budgeting mode based on the numbers you provided in the survey I mentioned earlier. So here's where we landed in terms of contracts. The amount you are reimbursed for each individual shared care plan will not change. For those of you who opted to do more shared care plans this fiscal year, the same reimbursement rate will apply. Only shared care plans that are completed and reported in the SPOC information form, or SIF, will be reimbursed. LPHAs who opt out of shared care planning will not retain funds previously designated for shared care planning. We will be providing a 16.9% increase to the Cocoon line item to cover inflation for all PHAs because of these funds that were freed up from those who opted out of shared care planning. There will also be some changes in data collection, which we will review in the next slide. Here are the changes that we've made to data collection. First and foremost, we've discontinued the FAM survey, including the requirement to report the family's contact information. Additionally, you may recall that in the past, there were specific categories for shared care plans, including new evaluations, reevaluations, complex shared care plans, and transition-focused care plans. We will no longer be requiring those different categories. We're also shifting emphasis in our data collection to capture how you're supporting the values of family-centered care and shared care planning. Many of you are aware of a new tool that we developed last year, the Family-Centered Shared Care Planning Assessment. It provides a structure for thinking about how to operationalize the foundational values of family-centered care or how to put them into practice. We are not requiring that the SCPA tool be completed, but we are using it to help reinforce and train towards family-centered meetings. We're adding a review of the tool to the Cocoon orientation and other learning opportunities over the course of the year. Updates are being made to the Shared Care Planning Handbook now to reflect these changes and will be shared with you soon. Finally, we're also considering some small changes to data collection on the SIP to remove some obsolete items and reflect this focus on family-centered care. We will release updates on this soon. Next, we want to discuss external meetings. Based on what we heard from nurses and families, we will support the idea of shared care planning taking place in the context of other kinds of planning meetings. We define internal meetings as meetings that LPHAs initiate and facilitate, whereas external meetings are meetings that outside organizations initiate and facilitate. So a few examples of these are IEPs, 504s, IFSPs, ISPs, wraparounds, and more. Going forward, we will continue to support external shared care planning meetings. We are now requiring more focus on family-centered care for all meetings. The main emphasis for shared care planning is having the right people at the right time to help a family address their goal. This applies to both internal and external meetings. Next, we'll have Brittany, our program administrator, explain some contract logistics.
Hello, my name is Brittany Tagliaferro-Lucas, and I'm Ocean's program administrator. I am here today to talk briefly about contract logistics for fiscal year 25, which runs October 2024 through September 2025. As you know, our contracts related to shared care planning are changing to a reimbursement model, and many counties are adjusting the number of shared care plans they expect to complete. Both changes impact budget and how we invoice. Let's first talk about budget. As mentioned previously, Cocoon funds will be receiving an increase to cover recent years' inflation rates. Shared care planning, however, will remain the same and will be based on the number of SPOCs completed that year. To help with budgeting, Ocean will be able to provide you information about the max funds available to your county. We expect to release this information over the summer. Please keep in mind, we will not be able to add additional SPOCs to your contract mid-year. Next, let's look at invoicing. Payments will still come in 2 installments. You will be able to invoice for your first payment upon execution of the contract. These funds will be for Cocoon. At the end of the year, you will be able to invoice for your SPOC funds. The amount you can invoice for will be based upon actual SPOCs completed. So it is critical that all SIF data is reported by October 15th in order to be counted. After October 15th, Ocean will generate pre-populated final invoice templates for you to submit for your SPOC funds. One quick reminder, final expense reports are not changing and they will still be required. Please reach out with any questions or feedback you may have. This is a new process for all of us, and we hope to make the transition as easy as possible. On behalf of the administrative and grants teams here at Ocean, we thank you for the work that you do for Oregon's children and young adults.
In conclusion, thank you so much for all of your hard work. We appreciate everything you do to support the implementation of shared care planning, and we also really appreciate your questions and your input as we went through this process. It really helped us hone in on what's working well about shared care planning and where changes needed to happen. We'll learn more from this next phase of work with you all and look forward to your continuous feedback. Speaking of feedback, there will also be a feedback opportunity at the regional meeting Q&A session. To make sure that we are prepared to answer any questions that you may have, we request that you complete the feedback survey by May 24th, 2024. You can access the questionnaire by scanning the QR code on this slide or clicking the link in the description below. Additionally, please feel free to reach out to Marilyn Berardinelli or Kim Tice if you have any pressing concerns. Once again, we want to thank you for everything that you do to make sure that shared care planning happens. We're looking forward to see how the implementation of shared care planning impacts families' lives during this next year.